Hello, I'm Miss Mary, and today I would like to talk about a relevant topic for interpreters, which is ethics in interpretation. But before starting, what's ethics? So, according to the RAE, Real Academia Española, ethic is the set of moral norms that govern a person's conduct in any area of life. Ethics is a branch of philosophy that deals with the study for the principle that govern human behavior, evaluating what is considered right or wrong, good or bad. It focuses on the reflection on the values and norms that guide our actions and decisions, both at the personal and social level. Ethics not only establish a framework for individual behavior. It also examines the implications of our choices on the lives of others and society as a whole. Through this analysis, ethics help us develop a deeper understanding of our responsibility in the impact our action can have on the world around us. Understanding ethics is essential for making responsible and conscious decisions in our professional practice as an interpreters. There are different types of ethics. The first one is deontological. It focuses on duty, nor or normal or moral obligation. In the professional realm, codes of ethics or deontological codes, as their name suggests, usually establish a common foundation of norms or principles to determine what is right and what is wrong, thereby guiding professionals in their work. These codes provide independent and predetermined action criteria that are documented in writing, allowing professionals to consult them in order to minimize misunderstanding and in situations of ambiguity, according to Dawson 1994. However, problems begin to arise when a professional finds themselves in a situation not covered by the codes in a field that the norms contained within it are not relevant in that context, leading them to decide to violate a particular norm. The second one is teleological ethics. It focuses on the consequence of actions. An action is good if it produces the best possible results. Interpreters face contextual decision that requires careful analysis of each case, considering the possible consequence of their actions. It's essential that they adapt their behavior to promote well-being and ensure effective communication between the parties involved. For example, in a conflict context, an interpreter might soften an offensive expression to avoid a violent reaction, thus prioritizing safety and harmony in the interaction. This ability to adjust the discourse not only reflects the professional ethics of the interpreter, but also underscores the importance of their role as a mediator in delicate situations. An example is a humanitarian interpreter decides to soften an offensive translation to prevent escalating a conflict between the parties. Here, they don't follow the textual fidelity to the letter, but seeks a more ethical consequence to reduce harm. We continue with virtue ethics. Foundations. The moral value depends on the character of the virtuous agent. Hertos and Pettigrew, 2022, define it as a trait of excellence in a person's character. According to virtue ethics, the relationship and importance of the interpreter is based on key virtues such as prudence, which allows them to evaluate situations and make informed decisions. Empathy, which helps them understanding emotions of the speakers. Honesty, which ensures integrity in the transmission of the message. And self-control, which enables them to manage pressure and the objectivity. These virtues are fundamental to ensuring effective and respectful communication, thereby it strengthening the role of the interpreter as a facilitator and understanding in various contexts. Finally, the ethical principles in interpretation are essential to ensure the qualities and effectiveness of the interpreter's work. Accuracy or fidelity requires the interpreter to convey the message exactly without omitting or adding information, which include maintaining the speaker's tone and register. Impartiality or neutrality means not taking side or showing personal judgment, ensuring that the interpretation is done without influencing the parties involved. Confidentiality is crucial, as the interpreter must protect the information obtained during the process, avoiding the disclosures of data about patient witnesses. Competence requires the interpreters to accept only assignments for which they are properly modified, such as refusing a medical interpretation if they don't master the specific vocabulary. Finally, integrity and professionalism are essential as the interpreter should act honesty, responsibility, and respect in all interactions, thus ensuring in their work. In summary, ethics it's not just a set of rules, but a reflective process that balances duty, consequence, and virtue. The role of the interpreter goes beyond the simply translated words. It involves a deep commitment to ethical principles that ensure effective and respectful communication. An ethical interpreter doesn't just translate words, but also conveys human values and respect between cultures by practicing accuracy, impartiality, confidentiality, competence, integrity, and professionalism. Interpreters becomes bridge between different realities, facilitating understanding and promoting harmony in diverse contexts. Their role is vital in an increasingly interconnected world, where respect for cultural difference and professional ethics are essential for building meaningful and lasting relationships.